Welcome back to Learning Anatomy with Dr. Bakari. And if you are visiting this page for the first time, you are also highly welcome. In this lecture, we'll be looking at the broad ligament of the uterus. The broad ligament of the uterus is an important topic and also very interesting. If we try to use this image by the side here to describe where the broad ligament of the uterus is located, this is where we have the uterus here, carried in black. If you go more laterally here, we have the ovary. And if you go more superiorly here above, we have the fallopian tube or the uterine tube. So if you look at this structure that is harrowed here in yellow, that is like a wrapper enclosing the three structures, this is what is referred to as the broad ligament of the uterus. And this is where you see this broad ligament helping to hold these three structures in place. We know that these three structures are located in the same region, and this is where it is helping to provide structural support for these three structures. So let's go through with this lecture where we'll be unfolding the orientation of these ligaments, highlighting the other functions that it exhibits around this space, and also some details that you should know as students of anatomy. The broad ligament is seen to extend from the lateral side of the uterus, and it is seen to be directed laterally, where it will be finally inserted on the lateral pelvic wall. If you try to use this lower image here, this is where we have the uterus. If you look at the uterus, you see that uterus itself is lined by peritoneum. So you see peritoneal covering on the surface of the uterus. If you look at this other end here, you see that part of the peritoneal covering is chopped off. This is just for us to know that the uterus is lined by peritoneum. And because of this lining of this peritoneum, this is what leads to the emergence of the broad ligament of the uterus. If you go to the lateral end here, that is harrowed in dotted yellow, we have the merging of the peritoneal layer. So you have this peritoneal covering the uterus. At this lateral head here, you see them coming together to form a double layer structure. And at this point here, you have the emergence of the broad ligament of the uterus. So this is where we have the broad ligament of the uterus emerging from. And after this emergence from this lateral end here, you see it directed laterally, where it will be inserted on the lateral pelvic wall. So if you look deep, you see that the emergence of the broad ligament of the uterus at this point is a double layer structure, because we have the peritoneal covering of the uterus itself merging at this lateral side. And this is where we then have the emergence of the broad ligament of the uterus. And this is what gives it a double layered picture. So you see that it is double layered, and it's seen to extend from this lateral end of the uterus, directed laterally to be inserted on the lateral pelvic wall. If you look at the position of the uterus, using this upper image, you see that the uterus is positioned anteverted over the urinary bladder. This structure that is highlighted here in black is the urinary bladder. And if you go more posteriorly behind, you have the uterus, but the uterus is placed in an anteverted position. If you try to straighten the position of the uterus here to make it stand more vertically, this is the kind of configuration that you would see in this image. And when it stands vertically in a coronal section, where you'll be having the anterior and the posterior view. So if you present the uterus in this kind of position, you see that the broad ligament of the uterus will be taking a wing-shaped appearance. And this is what is exhibited here in this image. Because in this image, the uterus is in a vertical position. And this is why you are able to see this presentation here of the broad ligament as an emergence from the lateral border of the uterus here, directed laterally to the lateral pelvic wall. You see it has a wing-shaped configuration, because the uterus here is now positioned in a vertical direction. Just for us to know that in case we have it in a vertical direction, you would be able to see the broad ligament exhibiting a wing-shaped configuration. And it is important for us to add that after the emergence of the broad ligament of the uterus on the lateral border of the uterus itself, you see that as it runs from this region to be directed onto the lateral pelvic wall, it is seen to accommodate the ovary and also the uterine tube. So you see that this broad ligament in a way is helping to hold these three structures in place. This is where you have the uterus, this is where you have the ovary, and more superiorly above here, you have the uterine tube or the fallopian tube. Can also be referred to as the oviduct. So you see that from the point of emergence of the broad ligament of the uterus to where it is finally directed to be inserted upon, it is seen to be holding onto these three structures. So it is seen like a wrapper onto which these three structures are embedded within, trying to help to position and also keep them in place. So let's drive further to highlight on the functions of the broad ligament. The broad ligament is seen to support the uterus. This is where we have the emergence of the broad ligament here, carried in yellow. And we say that this emergence is as a result of the peritoneal covering of the uterus itself. We say that at this lateral edge here is where they merge to become a double layer structure. And this is what creates the emergence of the broad ligament of the uterus. And due to this cause, it is helping to support the uterus itself. So it's helping to also hold the uterus in place. It is also helping to connect the uterus with also the surrounding structures. And in this regard, it is helping to provide connection with the ovary. This is where we have the ovary and also the uterine tube. It is located at the superior region. Then finally, we also have it creating accommodation sites for a number of ligaments and also neurovascular structures. If you look at this image here, you have a ligament here carried at this point. This is the suspensory ligament. And on this other hand here, we have the uterovarian ligament that can also be referred to as the ovarian ligament. This uterovarian ligament is seen to connect the ovary with the uterus. And you see this ligament also positioned within the broad ligament of the uterus. You also have a number of neurovascular structures also embedded within the broad ligament of the uterus. We'll be highlighting more on this as we go through with this lecture. But just for us to know that it creates accommodation sites for some ligaments and also neurovascular structures. So now let's drive through the orientation of the broad ligament of the uterus. We say that it is like a wrapper that extends from the lateral wall border of the uterus and directed laterally, where it is finally connecting with the lateral pelvic wall. So it runs like a wrapper. If you look at this configuration that you have on this side, you also have it on the other side. So let's try and highlight the orientation that it creates around its different borders. So medially, it is seen to be formed around the lateral margins of the uterus. This is where we have the lateral margin of the uterus here. And remember when we started this lecture, we said that the uterus itself is lined by peritoneum. And this peritoneum is seen to merge at this lateral edge. And this is where we then have the emergence of the broad ligament of the uterus. So you see that medially, the broad ligament of the uterus is positioned around the lateral wall or side of the uterus itself. This kind of presentation is also seen on the other side because we say that at this region, the peritoneal covering is chopped off here, just for us to know that it is truly lined by peritoneum. So if we have the peritoneal covering also at this other end merging, this will also lead to the emergence of the broad ligament of the uterus on this other side. And of course, will be directed laterally like a wrapper, where it will be fixing or connecting to the lateral pelvic wall. So we say that medially it is formed on the lateral margin of the uterus because these are the lateral margins of the uterus. So I hope this is understandable. While laterally it is seen to be connected to the lateral pelvic wall. And this is what is carried in blue on this other hand. You see it spreading wide like a wrapper or a sheet where it will finally be inserted on the lateral pelvic wall. So we now know the medial border and also the lateral border of the broad ligament of the uterus. So inferiorly, it is connected to the cardinal ligament, and this is what is carried in purple. The cardinal ligament is located at the inferior border of the broad ligament of the uterus. This cardinal ligament can also be referred to as the transverse cervical ligament. We'll also be highlighting more on this as we go through with this lecture. But just for us to know at this point that at the inferior border is connected to the cardinal ligament or the transverse cervical ligament. While superiorly above, what you have is the fallopian tube or the uterine tube. We say that this can also be referred to as the oviduct. So at the upper free margin of the broad ligament of the uterus, the structure that you have around that edge is the uterine tube or the fallopian tube. So those are the structures that you see around its different borders. It's also good for us to highlight what is seen in the anterior part and also in the posterior part. But we would be focusing on the peritoneal covering of the uterus. Remember when we tried to describe how we have the emergence of the broad ligament of the uterus? We said that this broad ligament of the uterus emerges as a result of the peritoneum covering the uterus itself. So it is important that we'll be attributing the anterior relation by focusing on the extensions that the peritoneal covering of the uterus creates. So we say that anteriorly, the peritoneal covering of the uterus is seen to form a pouch over the urinary bladder. And this is what is referred to as the uterovesical pouch. If you try to use this lower image here, this is where we have the uterus here, harrowed in black. We know that the uterus in female is sandwiched between the urinary bladder anteriorly and also the rectum posteriorly. So this is the kind of configuration that you have in the female pelvis. This is the uterus here, harrowed in black. Anteriorly at the front here, you have the urinary bladder. Remember that the emergence of the broad ligament of the uterus is as a result of the lining of the peritoneum of the uterus itself. So if you have a lining of the peritoneum covering of the uterus, you see it extending down, but not completely along its anterior surface, which means that there's going to be devoid of peritoneal covering along the lower region of the uterus, where it is seen to form a pouch around this region that is harrowed here in green. And this pouch is formed over the urinary bladder. This is where you have the urinary bladder here at the front that is also harrowed here in green. So you see that the peritoneal covering anteriorly is not complete. It is suspended around the isthmus. The isthmus of the uterus is a constricted region that is seen before the cervix. So you see the peritoneal covering extending to the isthmus before it is finally seen to form a pouch over the urinary bladder. And this is what is exhibited here in this image. If you go more posteriorly behind, we say that we have the rectum. It's also seen to form a pouch over the rectum. And this is referred to as the recto-uterine pouch or the recto-vaginal pouch. It can also be referred to as a pouch of Douglas. So if you look at this image here, this is where we have the recto-uterine pouch here, harrowed in dotted red. This is where we have the rectum here, also harrowed in red. So at the posterior region, you have the peritoneal covering descending more inferiorly when compared with the anterior peritoneal covering. If you go back to the anterior peritoneal covering, you see that it is not seen to descend completely down. It is seen to extend to the isthmus. But at the posterior region, it's seen to descend further downwards, where it will be reaching on the upper region of the vaginal canal. And this is where it now forms a pouch over the rectum. And this is what is harrowed there in dotted red. And this is what we refer to as the recto-uterine pouch or the recto-vaginal pouch, because it's seen to also extend to the fornix of the vaginal canal. It can also be referred to as the pouch of Douglas. So this is what is seen in the anterior peritoneal covering and also the posterior peritoneal covering of the uterus itself. So let's describe the zones of the broad ligament of the uterus. The broad ligament of the uterus is seen with 3 zones, and these 3 zones are related to the structures that are located within the broad ligament of the uterus. The first one is the Mesometrium. This is where we have the uterus here. Remember that the uterus is lined by peritoneum, and at this region here that is harrowed here in dotted red is where we have the emergence of the broad ligament of the uterus. We say that this is as a result of the union of the layers of peritoneum here at this lateral region. And this is where we have a double layer of peritoneum emerging at this lateral edge. So the zone of the broad ligament that is located around the uterus here is referred to as the mesometrium. This is the mesentery of the uterus, and this is the largest subcomponent of the broad ligament of the uterus. If you go more laterally, you have the ovary. The ovary also, we say that it is covered also by the broad ligament. So if you go more superiorly to this region that is harrowed here in black, we also have the emergence of the mesovarium. This is the mesentery of the ovary, and this is what is harrowed here in black. Then if you go more superiorly, we have the Mesosalpinx. This structure that is harrowed here in yellow is the fallopian tube or the uterine tube. We say that the fallopian tube is seen at the superior upper edge of the broad ligament. So if you go more inferiorly here, we also have the mesentery of the uterine tube, and this is referred to as the Mesosalpinx. So you see that these three structures that we have within the broad ligament of the uterus are also seen to be creating the basis onto which the zones of the broad ligament are created, where we have the mesentery of each of these structures creating the different zones of the broad ligament. And this is where we have the Mesometrium, the Mesovarium, and also the Mesosalpinx. So these three regions are collected together and are referred to as the broad ligament of the uterus. So let's look at the structures that are anchored by the broad ligament. Because we said that after the emergence of the broad ligament, it is seen to then anchor the other three structures within it. There are also other structures that are anchored within it. We'll be unfolding it as we go through with this lecture. But for this slide, we'll be looking at the different viscerals or organs that are anchored by the broad ligament of the uterus. And the first one here is the uterine tube. So we have two uterine tubes. We already said that the uterine tubes are located at the superior free end or border of the broad ligament of the uterus. And this is what is highlighted here in black. So as you have this emergence taping the superior free border of the broad ligament of the uterus, you also have it here on the other side. Then the next structure that we have are the ovaries. So this is where we have the ovary here. We also have two. We have one on this side and we have the other one on the other side. And you also have the broad ligament of the uterus also anchoring the ovary in this region. Then this other structure that we have is the uterus itself. This is where we have the uterus here. We know that the uterus is what actually leads to the creation of the broad ligament of the uterus. And this is why the ligament is so named the broad ligament of the uterus. We say that it emerges from the lateral margin here of the uterus itself. So it is also seen as one of the structures anchored by the broad ligament. Then the next structure is the ureter. Ureter, we have two, one on the right and the other one on the left. The ureters are urinary structure, and they are seen at the lower inferior border here of the broad ligament. So let's go through the next slide where we'll be describing the ligaments. We have a number of ligaments anchored by the broad ligament of the uterus itself. This is a ligament that is also seen to anchor other ligaments. So the first ligament here is the round ligament of the uterus. This is where we have the round ligament of the uterus here, arrowed in red. This is seen here on the other side. Because this other side here, the broad ligament is not opened, it is not exposed on this other side. But on this other side, it is exposed. So we can see the different ligaments that are anchored within it. And this region that is harrowed here in red is the round ligament of the uterus. And this is seen to emerge from the uterine horn. This is where we have the uterine horn that is close to just where we have the emergence of the fallopian tube. This region that is harrowed here in black is the fallopian tube or the uterine tube. So close to this region is where we have the emergence of the round ligament of the uterus. This round ligament of the uterus is an embryonic remnant that is referred to as the gubernaculum. This gubernaculum is what aids the descent of the ovary. We know that during developmental process, the ovary is developed around the abdominal region, but it descends into the pelvic region as development proceeds. So this gubernaculum is what aids the descent of the ovary during developmental process. So you see this round ligament, after emerging from the uterine horn here around this region, it is directed through the inguinal canal. Round ligament then runs through the inguinal canal before it exits it, and its fibers are finally inserted on the labial majora. So this is how it is connected to the groin region, part of the external female genitalia. And this tends to create anterior connection of the uterus. So it is the round ligament of the uterus that actually connects the uterus anteriorly. The round ligament of the uterus is actually responsible for the anteverted position of the uterus over the urinary bladder, because you see it drawing the uterus to the anterior direction. It is also important to highlight the importance of the round ligament of the uterus during pregnancy. During pregnancy, the round ligament of the uterus stretches, and this is how it gives allowance to the uterus to expand and extend into the abdominal region. So this uterus is able to move out of place and be able to extend into the abdominal space during pregnancy because of the expansion of the round ligament of the uterus. The ligament that we have is the uterovarian ligament. This is the uterovarian ligament here, arrowed in blue. Just from here breaking down the name, the uterovarian ligament is a ligament that connects the uterine end of the ovary to the superior border here of the uterus. And this is what is arrowed here in this image. This uterovarian ligament can also be referred to as the ovarian ligament or the proper ovarian ligament. And it is seen also to be anchored by the broad ligament of the uterus. So you can see the alignment of this ligament on the surface of the broad ligament here as arrowed here in this image. Another ligament that we have is the suspensory ligament. This is where we have the suspensory ligament here, arrowed here in pink. The suspensory ligament is also known as the infundibulopelvic ligament, and it is seen to connect the tubal end of the ovary here to the lateral pelvic wall. And this is what is seen here in this image. You also see this suspensory ligament or infundibulopelvic ligament anchored also by the broad ligament of the uterus. Then the next ligament that we have anchored by the broad ligament of the uterus is the cardinal ligament. This cardinal ligament can also be referred to as transverse cervical ligament or the Markendrot ligament. Remember when we described the orientation of the broad ligament of the uterus, we said that inferiorly it is attached or connected to the cardinal ligament. At this inferior region here that is highlighted in purple is where we have the cardinal ligament or the transverse cervical ligament. This ligament is seen to emerge from the lateral surface or lateral region of the cervix, which is the most inferior region of the uterus, and also the lateral region of the vaginal fornix. And the fibers are directed towards the lateral pelvic wall, and it is specifically inserted or connected to the ischial spine. And this is what is shown here in this image. So you have this ligament also anchored by the broad ligament of the uterus, but it is seen at the most inferior border of the broad ligament. And this is what is shown here in this image. The last ligament that would be highlighted is the uterosacral ligament. Just from here also breaking down the name, the uterosacral ligament is a ligament that connects the uterus with the sacrum. So it is seen at the posterior region, where it will be creating a posterior connection for the uterus. The uterosacral ligament is specifically seen to connect the cervical region of the uterus to the sacrum. It is seen at the lower region of the uterus here, where it is connecting the cervical region to the sacrum at this lower region. You can see that the round ligament of the uterus is seen to connect the uterus to the labial majora, and this is where it is creating anterior connection for the uterus. While the uterosacral ligament is seen to create a posterior connection for the uterus. While one ligament is trying to draw it anteriorly, the other is trying to draw it posteriorly. And if we go back to the round ligament of the uterus, you see that the point where it emerges from is from the uterine horn up here, while the uterosacral ligament is seen at this lower region. So you see that the pulling effect in the upper region, which is done by the round ligament of the uterus, will be having more impact on the uterus. And this is why we say that the round ligament of the uterus is responsible for the anteverted position of the uterus over the urinary bladder, because the uterosacral ligament in this inferior region will be drawing the uterus backward or posteriorly, while the round ligament at this upper edge will be drawing the uterus anteriorly. So you have it being pushed forward due to the effect of the round ligament of the uterus. And I hope this is understandable. And this can be used to justify clearly why the anteverted position of the uterus is attributed to the round ligament of the uterus. So now let's go to the neurovascular structures. We have a number of vessels and also nerves also anchored by the broad ligament of the uterus. We have the uterine vessels and also nerve, and this is what is highlighted here in red. Then we also have the ovarian vessels and nerve, also highlighted here in red. So you see these vessels around this region creating a number of anastomoses, and these anastomoses are located within the basanteries of these structures. And this is where they are enclosed or anchored by the broad ligament of the uterus. We also have the Sampson's artery. This artery is known to provide supply for the round ligament of the uterus. Remember, we described the round ligament of the uterus as one of the ligaments anchored by the broad ligament of the uterus. This round ligament is seen to be supplied by the Sampson's artery, which is a branch from the inferior epigastric artery. The inferior epigastric artery is a branch from the external iliac artery. So this is how we have a number of vessels also anchored by the broad ligament of the uterus. The broad ligament of the uterus in this image is removed so that we can see the different vessels around this region. So thanks for watching this video. Please continue to stay glued to this channel.